Hello, everyone, and welcome back. I'm Dr. Albus McDonald, licentious physician. Licensed physician. This is my third video to help unclutter the latest information about coronavirus. Lately, there has been a lot of exciting news, and I'm not talking about the return of Animaniacs, though obviously that's very exciting. Besides the promising vaccine results from Pfizer and Moderna, which I covered in my last video, there are even more new candidates. Now, after the recent election, I suppose the last thing anyone wants to hear about is another candidate. But these are different. First, there was an exciting development from the AstraZeneca company and Oxford University. They have yet another stage 3 trial and what looks to be a promising vaccine with up to a 90% rate of injection protection from their injection. At least that's the projection. The AstraZeneca vaccine seems most effective with one low dose followed by a regular dose some days later. The same is true when commenting on a friend's new hairstyle you don't like. Ease into it. Now, I feel a sense of personal pride in the research from Oxford University. I have a pullover from there. Says Oxford right across the chest. Anyone can buy them. Then there have been updates regarding 3 other potential vaccines, including one from the well-known health product company Johnson & Johnson, formerly known as Johnson, Johnson & Johnson, but then they kicked out Johnson. They did the right thing getting rid of Johnson. He was dead weight. Johnson. So these are very exciting bits of information. And we in the science community are feeling more optimistic than Jeffrey Katzenberg was about Quibi. There are even more companies and universities working on still more vaccine trials. If all goes well, it's likely that soon one or more of these will become available to emergency workers and other first responders. Next will be distribution to the elderly and infirm, and others who are the most vulnerable. But by this, they don't mean wide-eyed first-time New York City tourists who buy Hamilton tickets in a Times Square sub-basement casino. And you know what? I shouldn't have eaten their shrimp cocktail either. I know formaldehyde when I taste it. Never mind that. Back to the vaccine. Shortly after those at highest risk get a vaccine, doses would be prioritized by region, where the outbreaks have been the most severe, which is the same strategy I used to battle shingles, and a virus I discovered. Battle acne. It's the murder hornets of pimples. In the meantime, we must all do our part to help prevent the spread of the coronavirus through common sense. This includes hand washing, which I now support, and social distancing, and of course wearing masks on our faces, which I covered in my first video. Oh, I covered the faces, I just got that. Previously, I hadn't mentioned hand sanitizer, but it's good to remind you to use it, especially when a sink for washing isn't available, such as when you're in your car, or hanging out by yourself in the woods for some reason, or in my case, when you haven't paid your water bill and they've shut it off. I was in the middle of a bath, all lathered up, scrubbing my rubber ducky. How about some warning next time, water company? And late notices don't count because I ignore those. Anyway, make sure you read your sanitizer labels to make sure if it's of good quality and not sterilizer or fertilizer. You want a minimum 60% alcohol solution, which I also prefer in my flask. Now, before I conclude, I have an announcement of my own. I've become the celebrity spokesman for a unique new lifestyle app by a startup tech company called Rabies. In fact, if you've got any apps for living with a disease, it's probably rabies. They've created their flagship app, Rabid. It's a dating app for single contagious people looking for love among other patients diagnosed with the same illness. I call it the infection connection. Our catchphrase is, you can't catch it twice. Although, disclaimer, sometimes you can. It depends. It's available on Android and BlackBerry. Apple won't carry it. Regardless, I hope to have good news to share soon. I meet with my probation officer, Pablo, next week, so we'll see how much longer I have to wear this ankle monitor. It is a bother, but that's what happens when you sell used lab mice without a business license. I had no idea they were still radioactive. Anyway, that's it for now. Remember to like and share this video, and please subscribe to the channel. So, once again, from the Litmus Foundation Pharmaceuticals Laboratory and Needle Factory, this is Dr. Albus McDonald, reminding you to help prevent the spread of COVID-19. Keep yourself at safe distances, wash your hands, and whether you're using a dating app or not, use as many forms of protection as you can. Thanks for watching.